Hello, my name is Andy Medina, and today I will be speaking about access to women's reproductive health care in the United States. Through my advanced writing elective, I've been able to investigate women's and adolescent health, as well as the disparities in access that they experience. As an aspiring physician, my research led me to further explore reproductive health care. I look to answer the following question: how do disparities in women's health influence pregnancy rates in the United States? So why reproductive health care? As this New York Times article elucidates, teenage pregnancy rates in the U.S. have dropped by nearly 50% between 2007 and 2015. But teenage pregnancy must not be the standard. Approximately one-half of all pregnancies are unintended. Thus, prevention measures must be accessible to not only teenage girls, but women of all ages. Before delving into the existing literature, I wanted to hear from some women themselves and find out their thoughts on healthcare, gender roles, and pregnancy. The first individual I talked with was Professor Laura Chu from the Public Health Department of Santa Clara University. Here are some of her words.
Right, but unintended pregnancy actually includes unwanted and mistimed pregnancies. So it could be a woman who is in her 30s and married or in a relationship and isn't planning on getting pregnant but gets pregnant. Yeah. If you think about if it's a shifting political landscape and if you have Planned Parenthood funding being pulled, if you have Medicaid funding being cut, right, this is going to affect the women with the greatest needs.
The next woman I contacted was my sister, Amelia, who was open to sharing her story as a teenage mother. In speaking of her experience, she said,
"Pregnancy changed my life in many ways. I had to learn how to balance my life with my child's, and I also had to learn that someone else comes before me."
With these words in mind, it became apparent that disparities in women's healthcare arise primarily from four factors: access, culture and stigmatization, awareness and education, as well as legislation and funding. In terms of access to healthcare, there are three examples that illustrate the disparities that are currently affecting women and children by denying them both preventive and supportive measures. The first is access to publicly funded health clinics such as Planned Parenthood and community centers. These clinics provide family planning services to almost a third of all female contraceptive clients. Next is access to standardized, youth-friendly sexual education courses. With so much variation district to district and school to school, we must continue to strive for a fact-based approach rather than a value approach in terms of education. Lastly is access to contraceptives. Contraceptives prevent unwanted pregnancies, reduce the number of abortions, and increase education and professional levels for women. Although contraceptives benefit all members of society, access to contraceptives was not readily available to everyone until recently due to the Affordable Care Act. Because of the ACA, Medicaid, the largest payer of maternity care and publicly funded family planning in the U.S., expanded in 31 states. The rate of uninsured low and middle income women of reproductive age dropped 36%, and premiums or out-of-pocket spending for contraceptives since the ACA has dropped by over 18%. Although the ACA has bridged some of the inequalities in women's healthcare, there are nevertheless disparities that exist. These disparities lead to unintended pregnancies, which ultimately have consequences for mother, child, and those around them. From alterations of mental states to career and educational trajectories to monetary costs and leisure time, it is evident that pregnancy clearly affects one's future. There is no one path towards amending this domestic issue. However, at a basic level, we may start by erasing the inequality we see in our homes, workplaces, and even in our own healthcare system. We can start by giving control back to women, control over if and when they wish to become a mother, control over what they wish to pursue in life.